Have a look at this clinical question. Good. So the spread of answers, the three most popular answers are A, repeat the advice and review. F, prescribe tirzepatide. Mounjaro is the brand name for that. And then the most popular, G, refer to secondary care. The correct answer here is G. So well done. That was the most popular answer. About half of you picked that. So about half picked one of the other options. So let's look at why this patient should be referred to secondary care. Well, if you have a look, they've already tried orlistat and they've lost some weight, but only 2%. All right. That's in 3 months. Their body mass index is still 31. So it's still in obesity 1. So they're still at increased risk. And you can see they're, sort of stuck on this. They're not losing any further weight. They would benefit from losing more to get to a healthy weight range. They're still obese and so for at increased risk, right? Okay. So the reason the correct answer is G is that this patient, if they're going to be considered for some of the other options, for example, Saxenda, this level would be within the license for that. That's something that will be prescribed in secondary care. Okay. Tirzepatide, we can prescribe in primary care, but they don't meet the sort of nice guidelines for the prescribing threshold for that. We'll look at that in a minute. Okay, we'll look at all of the main drugs and what the indications are in the guideline. That brings me on to something else that's really important, and that is that sometimes what you'll see is that there might be local formulary or local funding available for certain medications, and that can vary from one area to the other. The answer in the exam isn't going to be based on that because they don't know where you're training. They don't know what the different regional variations are in that situation. They're going to base it on if there's a nationally published guidance, like NICE guideline, what does the guideline say? Okay. So that's why the correct answer is G, is that this patient doesn't fulfill the criteria for us to prescribe tirzepatide. Liraglutide, Saxenda, while it's within the license, that's not something we can prescribe in primary care. It's a secondary care specialist obesity service in the NICE guideline. Okay. Hope you found that helpful. Please do subscribe to the channel, like and share with your colleagues if you'd like more content.